I have not gone live in a while. Make sure this is going. Okay. Okay, I think I can see comments now. If anyone has questions, just put them in the comments while I'm going through this. Otherwise, this will be recorded and you'll be able to watch it whenever. I'm going to be talking about running protocols for warm up and also injury prevention / rehab for the foot and ankle, because let's face it, ankles and knees tend to be the most problematic areas when we're talking about running and runners getting prone to injury. It tends to be knees and ankles. So to start out, some just foam rolling is usually a really great way to start. I'm not going to go through my the whole foam rolling routine, but I'm going to just show you the movements that I tend to stick to pre-run, which would be my glutes, my quads, and my TFL and calves. So, sitting on the roller, ankle up over the knee, and just roll. Doesn't need to be a ton of time. It's just enough to wake those muscles up because we want to get some blood flow. What you don't ever want to do is stretch cold muscles. You can actually pull your muscles that way, given you have to be pretty aggressive to actually pull one. But it's always much smarter and safer to get your muscles warm first. And this will help do that. It'll also just help wake all of those tissues up for us to activate them with some really targeted strength moves. So just like 30 seconds, whatever feels good. And then I'm going to wake up quads. So I just start up at my hip and come forward. I like to turn my toes in as I go through that. Camera angles are going to be a little problematic, apparently. Okay. So rolling quads, I like to turn my toes in a little bit, rolling to just above my knees. About 30 seconds. I don't recommend rolling your IT band. Number one, your IT band is not a muscle. It is a tendon. And so it's kind of like a tire tube. It's crazy tight. But the best way to affect your IT band is going to be through your TFL. And your TFL is this like 6-inch band of muscle that comes a little in front and to the side of where your hip flexor is, okay? Where your hip comes into that hip socket. So, and this one tends to be pretty ouchy, but it's very important to work on it. Okay, and again, just like 30 seconds or so, however long until you feel it, just give a little bit. Each side, of course. I'm doing just enough to show you the movements. And then calves are good, whether you do both at the same time or just one at a time. I'm, of course, rehabbing a muscle tear right now along my calf because I didn't do all of these things before every run, and I hadn't been able to run for over 2 years, which some of you know. I had a condition called MALS, median arcuate ligament syndrome, that made cardio not possible for me for about 2 years. Now, the last one, of course, is going to be for the adductors. Knee over top, and just rolling along that inner thigh. So all in all, you're talking less than 5 minutes of this foam rolling just to wake things up. then once I go through my foam rolling, I really like this runner stretch. Just coming into this runner stance. You can either bring the knee down or you can be in an elevated position. And from here, I like to just lower my elbow down and then reach up. So I'm getting some nice thoracic mobility as well. Both sides. And really, whatever feels good. I tend to stick between 6 and 10 per side. Doesn't need to be a ton. I'm just going through it once. The important thing here being that I'm working to lengthen here and get some good hip extension. So when we're running, the main joint action that we are dealing with is hip extension. And so we want to work on lengthening here. So we know that our hip extension is solid and that we're actively working on it. And the other piece of the puzzle with that hip extension is going to be our prime movers of hip extension, which are our glutes, which we'll do next. Okay, so I did my runner stretch, and then I'm also just going to do a pigeon, a light pigeon to get the piriformis. And if this move is just too much for you, you can also do this seated with the ankle over the knee, like so. Or laying back like this, okay? And with your hip extension, if that runner's move is a little much, you can also just do a kneeling hip extension where you squeeze the glutes, tuck a little bit, and just come forward into that hip extension. And you can come up and reach a little bit with the arms to get just a little bit of extra stretch and extension through there. Okay. Now, quick and dirty through that, we're going to go into glute activation. And then from glute activation, we'll go into my foot and ankle protocols, which is, I know, what most of you are waiting for. So we're going to go through 3 moves, just one round, okay? I'm going to start with clam shells. So I'm going to take a hip band. You can get them on Amazon, or I really like this set by Britta Peterson, the Performance Refinery, equiformancebands.com. She makes them in different sizes to fit either different bodies, which I really like. But Amazon also has them in pretty cheap sets. I've got links here on the page to them. So clam shells. The important thing here is that we're hitting the glute med, which is this little glute muscle toward the top of your booty, of your glutes. Now you want your ankles stacked in line with your spine, and from here I'm going to bring that knee up, and I like to put my thumb on that glute med. So as I come up, I'm really focusing on that glute med. If you're not really feeling it and you're struggling, I would recommend backing up against a wall so that you've got the entire length of your spine and your ankles against that wall. That's going to help isolate that movement pattern, because it's really easy in this move to let the hip just kind of roll back to make it easier, and then you're going to be feeling more in your hip flexor and your back than you are that glute med, which defeats the purpose of the exercise, and that sucks. So I'm going to do about 15. I'm obviously not counting right now. And then I'll switch sides or just roll over and do another 15. Just really focusing on that glute med. Good, I'm on 10. Awesome. Now I'm going to go into a fire hydrant. All fours. And from here, I'm just going to lift that leg and pee on the fire hydrant. And again, I'm going to do about 15 per side. And with this move, my leg is pushing slightly back and out to the side. same muscle, that glute med, is my focus. Glute med tends to be weak in a lot of people, and this is your prime mover for that hip extension. So if your glutes aren't strong, you're leaving yourself open for all kinds of potential injury issues. The glutes are amazing. They are literally the biggest muscle on your entire body. Believe it or not, they're so thick. And they're weak in so many people. So really important to keep them active and to keep working on strengthening them and pushing them through, what we call hypertrophy. So they grow and develop and continue to get stronger. You can't overwork your glutes, is what I'm saying. Oh yeah, that burns. $13. Awesome. So now my glutes are really fired up. And the last glute activation move I'm going to do is a kickback. You can do this with your band, just leaving your band where it was and coming up like so. But if you have a mini band as well, one of these really thin ones, they're super cheap. They're really useful. I put them around my feet. And this is my favorite glute activation warm-up move. Just come back, extend that hip. So I'm getting hip extension, but I'm also turning on my glute max, okay? The biggest, meatiest part of your glutes. And again, about 15 per side, once through. I'm going to keep it at 10, just keep it slow. If you're following along, just press pause. All right, so those glutes are turned on. They are ready to work. And now we're going to move into foot and ankle. So, ankle stability is extremely important. Our bodies are built from the ground up. Ouchie. yeah. Yeah. Okay, so, where was I? Okay. Ankle stability. You have two muscles that are key when it comes to ankle stability. You've got your anterior and posterior tibs, your tibialis, and you've got your peroneals. Okay, those are our key points when it comes to ankle stability. And you want your ankles to be crazy strong. You also want to have a decent amount of ankle mobility. When you sacrifice either of those things, you're setting up a recipe for just a chain reaction of issues up your joints, especially through your knees, and then of course that travels up into your hips, which is going to affect your running. And I of course went and tore my muscle because I wasn't doing these things before my runs, because I thought I was invincible and still 21 years old after 2 years of not running. Really smart, taking my own coaching advice really well there lately. But let's dive into this. I like to start on pipes, and you can pick up PVC pipe at any hardware store. They're really cheap. These things are, let me think about this, 4-inch diameter, and I get a 2-foot piece and just have them at the store, cut it in half, so you've got 2 pieces here. And I also find these really helpful. I use them for a lot of different things, especially with clients as we're working on range of motion through lunges, through squats. They're just really helpful. Okay, and this is going to look scary at first, but I promise it's not. And especially if you're somebody who has struggled with plantar fasciitis, this is incredibly powerful. I've helped multiple people over the years rehab from plantar fasciitis using these strategies. Because oftentimes they recommend rolling on like frozen water bottles, but doing it like this, you can bypass the need for the frozen water bottle and at least get in that soft tissue work for the bottoms of your feet. And it also helps with strengthening those muscles that come through the bottom of your feet, because we have 29 to 33 muscles and joints in our feet and ankles, which is pretty amazing when you think about it. And we don't, in our training, typically focus much on our feet. And to me, I think that that's short-sighted. Okay, so I'm going to get up. You can also do this in front of something more stable, whether it's a chair or a countertop. To start out, some people feel a lot more comfortable having something more stable, but I really like pipes because I'm still going to need to activate my core as I'm going through this. And if I start feeling brave enough, I can set them down or take the pressure off of them. Okay, so I step up onto my pipes on the balls of my feet, and what I'm going to do, I'm going to push my feet apart and then pull them together. I'm staying nice and tall, push my feet apart, and then pull them together. Nice and slow. And pull them together. And I'm going to go through 8 to 10 rolls back and forth. That tends to be my go-to. And then as I hit that, I'm going to step back and just switch my foot position. You can also, of course, step all the way off the pipes and step back on. But I've been doing this for a long time. Push them apart. Like years I've been using this. I love it. It's one of my favorite things. And again, about 6 to 8. Okay, and then I'm going to switch my position, toes out. Please don't be intimidated by me just stepping around on these pipes. I've literally been doing this for years. But most of my clients will just step off, set up, and step back up. Okay, here we go. So I'm going to push out, and it just kind of feels like a ballet plie without the bending. Push out and in. And again, about 10 rolls back and forth. And for most people, I start with just these 2 moves, but I'm also going to show you my more advanced stabilization move on these pipes, just because I really enjoy it. And when you're ready for it, it'll be here. Okay. And so again, you can always step off, but I've been doing this a long time. Okay. So I'm going to then have my feet just forward facing on my pipes, and I'm just going to roll a little bit back and forth through eversion and inversion, because our ankle, even though our ankle is technically, it's a hinge joint, but we have so many joints in there that glide around. We have a lot of range of motion, surprisingly, which we're going to talk about more in a minute. And I'll do this 30 seconds to a minute, and you'll feel those stabilizing muscles firing and working really hard. Hi, buddy. This is Oz, my 16-year-old baby. Okay. Now my feet are all fired up and ready to do a little bit more work. And I move my camera angle down a little bit. Okay, so for this, the next couple of things, this piece of equipment is incredible. My buddy Kurt, who I've known and worked with for over a decade, the dude is a genius and he's amazing, and I absolutely adore him. His company, Roundbox Fitness, makes these mini ramps, and I'm gonna take you through this routine. Okay, and this routine is gonna help to strengthen your stabilizing muscles through, your tips, your peroneals, and it's also gonna help correct any mobility limitations that you are struggling through. Ankle mobility is extremely important, and you can always do a test for your ankle mobility by setting your foot up about 5 inches from the wall, and from here, keeping your heel flat on the ground hands can be on the wall. You're gonna push that knee forward, and you wanna be able to get within an inch of that wall or touching that wall with your heel still flush on the ground, okay? And if you're able to do that, then your ankle mobility is pretty good, okay? Normal range is 20 degrees, but if you are actively doing sport, you could need anywhere from 20 to 40 degrees even, depending on your sport, depending on your activity levels. And obviously ankle mobility is going to be important when we're running in terms of stability. So when we run, those footfalls are going to be pretty neutral onto the ground. You don't want to heel strike or have a lot of excessive dorsiflexion while you're running, but you still want to have access to that mobility so that your foot and ankle, your ankle in particular, can properly stabilize, okay? And that's going to help prevent injury and other issues. Now, I'm going to come up onto my ramp. You can do this with a step stool or just on the floor, but I tell you what, I've been doing this a long time, and this little bit of elevation, it changes the game. It really helps to isolate, especially the tibs and peroneals. Okay, so I'm going to get up here, and I've got my band set up, so I've got it looped. I don't know if you can see that real well, but I've just got one band, and it's looped through a carabiner. You can use door anchors, like those fitness door jam anchors. They're great. And from here, I'm going to pull, okay, into dorsiflexion, and I'm going to hold for a second, and then nice and slow, I'm going to control coming back forward into plantar flexion. Nice and slow, and back. And you can do anywhere from 15 to 25 of these. And you can increase the challenge based on the band tension. You can use thicker bands. There's a lot of variability where you can challenge yourself and progress this. Feels really good. And so this is go-to to help strengthen your tibs, which are right here along your shins. Incredibly important, and so few people really train them. Okay. Oh, and we can also, sorry. Ugh. Here we go. So I've got my front back, but you can also externally rotate at the hip and go through the same motion with that external rotation, so you can hit those peroneals as well. Very important for your stability. Okay, so again, we've got neutral position, pull and release, external rotation, pull and release. And mine is injured right now, so that fatigues fast, but powerful. Okay, awesome. So, and again, you can do this on the floor without this ramp, but the ramp really adds something to this. And I'll put a link in the description of the video to contact Kurt if you want to ask about getting one of these. I highly, highly recommend them. All right, I'm going to change my angle a little bit, and we're going to go through these last two moves. There we go. Okay. So next is going to be our elevated heel raises, okay? And the reason the ramps are so important for this move is because we're going to start out in this dorsiflexion, and we're going to work to strengthen, okay, our gastroc, soleus, but our focus is going to be, again, in the tibs. Okay, so I'm going to come up and nice and slow back down. So when we're elevated like this, I'm able to get more into this tibialis. And yes, you're going to feel your calves as well. Nice and slow and controlled. And you can, I don't know if I said this earlier, you can get these tall PVC pipes at just about any hardware store. They're stupid cheap, couple bucks. Very useful. And here, I'm going to do, again, anywhere from 15 to 25. You can hold for a second at the top, nice and slow down. There are lots of different cadences that you can play with to challenge those muscles and joints. Awesome. Okay. Now my last move is going to be to help stretch the soleus, and also is going to help these muscles that run around your kneecap. Okay. And I like to set up my stool, my ramp rather, about 5 inches from the wall. Okay. And from here, I'm going to be on the ball of my foot, and I'm going to push forward, bringing my hamstring to my calf, and then come up. And so my ankle's coming up a bit, and I'm in the ball of my foot, and so I'm going to get a nice stretch here through these muscles surrounding my patella, and come up. You can also do this with just your pipes. Okay. Move this camera angle down a little bit. Anywhere from 10 to 15 per side. This is going to help with our dorsiflexion, developing that ankle mobility, and then we're also working to stretch through the soleus and the gastroc back here through our calves, because they tend to get really tight. But by now we're good and warm, and they're ready to get some stretching. So 10 to 12. And if I'm doing rehab, like I am right now, I'm going to do 3 rounds of that, okay? Not everything I just did, but of the ankle work between the, between our, the tib pulls, the external rotation, and the heel raises, and this lunge. I'll go through that a couple of rounds, and that's a pretty solid protocol for injury rehab surrounding the ankle and foot. Obviously there's a lot of case specific there, ways to tailor that program to specific pain complexes, but if you have a question, just shoot me a message or put it in the comments, and I'm happy to respond to those, happy to further demonstrate things. So let me know. I hope that is helpful, and I will see you guys soon.